Good evening, wherever you are. This is Luna Vale from ConferenceHype. Our segment will focus on Gotistobart or Docetaxel in metastatic squamous non-small cell lung cancer, stage 1 of the randomized phase 3 PRESERVE-003 trial. From the 2026 June edition of Nature Medicine. PRESERVE-003 is a two-stage phase 3 trial evaluating Gotistobart, a novel pH-sensitive anticytotoxic T lymphocyte-associated protein 4 antibody that selectively depletes regulatory T cells within the tumor microenvironment in patients with metastatic squamous non-small cell lung cancer without actionable genomic alterations who progressed on programmed cell death protein, programmed death ligand 1 inhibitor platinum-based chemotherapy. Population with a poor prognosis. Here we report on stage 1, which aimed to confirm the dose and assess the preliminary efficacy, primary outcome, overall survival, secondary outcomes, progression-free survival, objective response rate and duration of response, and safety of Gotistobart compared to Docetaxel. Patients with SQ-NSCLC were randomized to Gotistobart or Docetaxel. From the 2026 July 22 edition of Nature Medicine. Fc receptor homolog 5 is a membrane protein that is ubiquitously expressed on myeloma cells. Cevostamab is a first-in-class, FcRH 5 times CD3 bispecific antibody. GO39775 is a phase 1 dose escalation and dose expansion study evaluating fixed-duration cevostamab in relapsed or refractory multiple myeloma. Cevostamab was initiated with step-up dosing and continued at the target dose once every 3 weeks for 17 cycles unless disease progression or unacceptable toxicity occurred. Primary objectives were to evaluate safety, including determination of the maximum tolerated dose, and to identify a recommended phase 2 dose and schedule for cevostamab monotherapy. Secondary objectives included determining the rate of response and the duration of response. As of 24 February 2025, 324 patients had been enrolled. Most were heavily pretreated. Prior B-cell maturation antigen-targeted therapy, 47.5%. From the 2026 May edition of Nature Medicine. Therapies targeting the natriuretic peptide system have the potential to reduce death or heart failure events in heart failure with reduced ejection fraction. Here we assess XXB750, a human monoclonal antibody activating natriuretic peptide receptor 1, in patients with heart failure. Patients with heart failure and a left ventricular ejection fraction 50% were enrolled. Those patients who were on background angiotensin-converting enzyme inhibitor or angiotensin receptor blocker treatment were randomized to receive 60 mg XXB750, 120 mg XXB750, or placebo in a blinded fashion, or sacubitril/valsartan treatment in an open-label fashion. Those patients on background sacubitril/valsartan treatment were randomized to either 60 mg XXB750, 120 mg XXB750, or placebo treatment in a blinded fashion. The primary endpoint was the change in NT-proBNP levels at 16 weeks after treatment initiation, and safety was also assessed. From the 2026 July 21 edition of Nature Medicine. SCN2A variants are among the most common genetic causes of developmental and epileptic encephalopathies, which can present with uncontrolled seizures at birth and account for 1–2% of all epileptic encephalopathies. A substantial fraction of causal variants are gain-of-function or mixed-function variants associated with increased channel open probability or greater sodium current flux. Here 2 parallel N=1 clinical studies were conducted in 2 patients with SCN2A-related D. Individualized allele-selective antisense oligonucleotides were designed to target heterozygous internic single nucleotide polymorphisms for decreased expression of mutant SCN2A transcript while preserving the wild-type copy. Primary endpoints included quantitative change from baseline in seizure frequency and neurodevelopment, including motor scores. Efficacy measures were also individualized to each patient's phenotype, including refractory seizures, developmental delay, autism spectrum disorder, choriothetosis, and gastrointestinal dysfunction.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 June edition of Nature Medicine. Although a dietary approaches to stop hypertension eating plan has been shown to lower blood pressure in Black adults, this intervention has not been tested in individuals who were being actively treated for hypertension. In this study, we conducted a randomized clinical trial to test whether local groceries ordered with the assistance of a dietitian to align with the DASH diet might lower BP among Black adult residents of Boston communities, with few grocery stores who were being actively treated for hypertension. Individuals whose systolic blood pressure was 120 mmHg to 150 mmHg despite active hypertension treatment were randomized either to 12 weeks of weekly home-delivered DASH groceries with dietitian counseling or to receiving three US $500 stipends every 4 weeks. The primary outcome was research clinic measured SBP measured at 3 months. From the 2026 July 24 edition of Nature Medicine. The accurate and timely diagnosis of inherited retinal diseases represents an unmet clinical need in ophthalmology, as the current pathways rely on resource-intensive phenotyping, multidisciplinary expertise, and genetic testing. Here we developed Retina 4 IRD, an artificial intelligence-based clinician decision support system that predicts 17 genotype categories from retina images. Retina 4 IRD uses a vision transformer model pre-trained with RET-found. We then trained and validated Retina IRD using multimodal data with color fundus photographs and optical coherence tomography scans from 1,843 genetically confirmed patients across China, South Korea, and Poland. The top 5 prediction accuracy was 0.904, 0.8960912, and 0.856 for internal and external validation, respectively. We conducted a randomized controlled trial with 300 participants with suspected IRD randomized 1 to either Retina 4 IRD assisted specialist arm or specialist-only arm. From the 2026 June edition of Nature Medicine. Polycystic ovary syndrome is an endocrinological disorder characterized by weight loss resistance. Time-restricted eating has become a popular weight loss tool. However, the efficacy of TRE for weight management in PCOS remains understudied. We evaluated the effectiveness of TRE compared with standard care and a no-intervention control in women with PCOS. 76 participants were randomly assigned to one of 3 groups for 6 months, a 6-hour TRE regimen, a complete response plan, or a control group with no dietary changes. The primary endpoint was % change in body weight at 6 months. From the 2026 July 23 edition of Nature Medicine. Although therapeutic options for hidradenitis suppurativa continue to expand, unmet needs remain substantial. We evaluated the efficacy and safety of povorcitinib inhibitor in patients with moderate to severe HS in 2 randomized trials. STOP HS1 and STOP HS2 were identically designed, randomized, double-blind, placebo-controlled phase 3 trials. Adults with moderate to severe HS were randomized 1 to once daily treatment through week 54. Povorcitinib 45 mg, povorcitinib 75 mg, placebo with crossover at week 12 to povorcitinib 45 mg, or placebo with crossover at week 12 to povorcitinib 75 mg. The primary endpoint was high SCR 50 greater or equal to 50% decrease in total abscess and inflammatory nodule count, with no increase from baseline in abscess or draining tunnel count at week 12. STOP HS1 STOP HS2 enrolled 608-619 patients, respectively.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 July 21 edition of Nature Medicine, spinal cord injury causes irreversible motor and sensory deficits, and no therapy currently restores the damaged neural circuitry. Previous work has shown that transplantation of induced pluripotent stem cell-derived neural stem progenitor cells restored motor function in preclinical models of subacute SCI. However, the safety of this approach in humans remains unknown. Here we report results from a first-in-human, open-label study of iPSC NSPC transplantation in 4 patients with subacute cervical complete SCI. The primary safety endpoint was achieved, with no tumor formation or graft-related adverse events observed during 4 years of follow-up and stable graft sites on imaging. Exploratory efficacy was assessed as a secondary endpoint. From the 2026 May edition of Nature Medicine, copathology is a common feature of neurodegenerative diseases that complicates diagnosis, treatment, and clinical management. However, sensitive, specific, and scalable biomarkers for in vivo pathological diagnosis are not available for most neurodegenerative neuropathologies. Here we present proteomics-based artificial intelligence for dementia diagnosis, a deep joint learning model on 17,187 patients and controls that uses plasma proteomics to provide simultaneous probabilistic diagnosis across 6 conditions associated with dementia in aging. PROT-ADX achieves cross-validated balanced classification accuracy of 70-95% and area under the curve of 78% across all conditions. The model's diagnostic probabilities highlighted subgroups of patients with copathologies and were associated with pathology-specific biomarkers in an external memory clinic sample, even among individuals without cognitive impairment. From the 2026 May edition of Nature Medicine, clinician-patient conversations form the cornerstone of mental health care. Large language models could hold promise for this domain, but their effectiveness in patient-facing interactions remains largely unproven. Here we introduce a cognitive layer architecture that enhances general-purpose LLMs with specialized clinical psychotherapeutic reasoning capabilities. In a randomized, double-blind evaluation, 227 human participants generated naturalistic mental well-being session transcripts by interacting with different therapy agents. A consortium of 22 expert clinicians assessed these transcripts, finding that LLMs augmented with this architecture consistently outperformed both standalone state-of-the-art LLMs and human clinicians across key clinical competencies required for delivering high-quality cognitive behavioral therapy. We validated these results in an analysis of 19,674 transcripts from a large-scale, real-world deployment, where an LLM embedded within this cognitive layer architecture was used as part of healthcare delivery to support 8,920 users seeking mental well-being assistance. From the 2026 July 24 edition of Nature Medicine, there's a need for robust evaluations of non-invasive biomarkers for metabolic dysfunction-associated steatotic liver disease. This prospective multicenter study assessed the diagnostic accuracy of imaging using magnetic resonance elastography and fibroscan, serum biomarkers, and composite scores for centrally read steatohepatitis and fibrosis. For cirrhosis, several biomarkers exceeded the minimum acceptable performance criterion, including MRE 0.91, P 0.01, VCTLSM, Agile 3+, and Agile 4. Among 357 participants, fibrosis stages F0, F4 were present in 12%, 16%, 25%, 32%, and 15%, respectively.
This is Conference Hype. Stay with us, coverage continues.
for now for Conference Hype's coverage of the July 2026 issue of Nature Medicine. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.